Hippel-Lindau disease affects about 1 in 35,000 people who are born worldwide. This is something that we actually find in all populations around the world. About 80% of individuals will inherit this from a parent, and about 20% will be de novo mutations, meaning that just during early embryogenesis, they'll have a mutation in the VHL gene that will then be distributed throughout their bodies as they develop into humans. The VHL gene, its job really is to regulate some of the transcription factors like HIF1 alpha and HIF2 alpha. So if you have broken VHL, what you get is you get an excess of HIF1 alpha and HIF2 alpha signaling and the consequences of that. And one of the most sort of commonly described consequences would be inappropriate angiogenesis or blood vessel formation, where you have high levels of vascular endothelial growth factor production. So you get very vascular areas around these mutant cells. And so that then leads to us seeing very vascular tumors in these patients, and they have pleiotropic manifestations. They get retinal, spinal, and cerebellar hemangioblastomas, which are non-cancerous, but very vascular and growing in inappropriate areas in the eye and the spine. They also get endolymphatic sac tumors in the inner ear, which can cause deafness. They can get pheochromocytomas. They can get pancreatic neuroendocrine tumors, which are bona fide cancers in the pancreas, and if they exceed a certain size, can metastasize, mostly to the liver. They can also get renal cysts and renal cell carcinomas, and the renal cell carcinomas, if they don't get managed properly, can also metastasize. And these renal cell carcinomas are multifocal and bilateral. So individuals basically face a lifetime of surveillance, followed by interventions. At this point in time, there's no FDA-approved drug for VHL disease, so most of these individuals face a lifetime of interventions in the various parts of the body where the disease is manifested. So if we see a mass in the kidney or the pancreas exceeding 3 centimeters in size, those will be operated on, or in the case of the kidney, can potentially also be ablated with some type of thermal ablation technique. In the eye, if they develop hemangioblastomas in the eye, they will get laser treatment to these areas. The brain and spinal hemangioblastomas, at this point in time, the best treatment is operation, although some will actually radiate them as well with stereotactic radiosurgery. So these are the types of interventions that people will get.